Hello and welcome to the Scotland Clinic Update webinar. My name is Emily. I'm from the Fertility Network UK team. Joining us today from Glasgow, I'd like to welcome lead clinician Dr. Lyall and lead embryologist Joanne Leith. From Aberdeen, we have Centre Manager Alison McTavish and consulting Dr. Maheshwari. From Edinburgh, we have Quality Manager Dave Wales and Fertility Unit Manager Kelly Hayden. From Dundee, we have Infertility Counsellor and Chien. And finally, Gwenda Burns, Chief Executive of Fertility Network UK. On behalf of all of our viewers, I'd like to thank you all for joining us for this webinar, and I'd like to hand over to Gwenda Burns. Thank you.
Thank you, Emily. And we have some pre-submitted questions that we had asked for in advance, and I'd just like to thank everyone who sent their questions in. And to kick us off today, we'll firstly go to Alison in Aberdeen. And first question is, what are the waiting times for new NHS patients now?
Best if I unmute first, but thank you, Gwenda. That's a question that patients are always very keen to find out what the current waiting times are. And across the clinics at the moment, they're about 6 to 10 months. There is a national waiting time standard, which is 12 months, and we all work within that parameters. And I have to say, this year we've all worked really hard, considering that we were closed for about 3 months due to the pandemic. And restarting the service has actually required quite a few changes in the way that we operate. However, I think everybody should be reassured that we're doing what we can to keep the waiting times below the 12 months for sure. And we just thank everybody for their patience. We know it's been quite a challenging year, but we're absolutely delighted that nobody has had to wait any longer than this standard, which, considering what's happened this past year, is actually quite amazing. So I hope that answers that question, Gwenda.
Thank you, Alison. And I think the waiting times that you've just shared actually demonstrates the hard work that definitely has gone in by the clinics. And just going across to Glasgow next to Dr. Lyall, will the clinics be continuing throughout the Christmas period to provide NHS treatment?
Thanks, Gwenda. Yes, we can be reassuring that the clinics will continue over that period. We will have slightly reduced capacity over Christmas, and this is because there is a short closure for the laboratory to maintain equipment, and this is something which happens every year. Because of this, although we'll be doing procedures, they will be limited, but we will be doing consultations, so patients will be prepared for treatment in the new year, and also the support services will still be in place. But this is only for a short period of time, and we can be reassuring that it won't have a major impact on the waiting times.
Thank you, Dr. Lyall. And just staying with Glasgow and coming to Joanne, what is the waiting time between a failed first cycle and starting the second cycle?
Well, I'm so sorry to learn that your first cycle was unsuccessful. The waiting time for a second cycle is much shorter than waiting on your first cycle. It's approximately 3 to 4 months. But the timing is also guided by the individual patient. Some patients may need additional time to regroup between cycles of treatment and may wish to wait longer before undertaking a subsequent cycle. So the timing does depend on when the patients are ready to start, and it needs to be a time frame that's right for the patient in discussion with the clinic.
Thank you, Joanne. And just coming across to Aberdeen to Dr. Maheshwari, what is the waiting time for patients waiting on NHS donor egg treatment?
Thanks, Gwenda. I'm afraid the egg donor waiting times are long, and part of the reason for them being long is because we are short of egg donors. We were all set to start a donor campaign in 2020, However, like a lot of other things, COVID didn't let that happen. They were stopped because of the COVID. Now, for egg donation, as you know, in this country, it's an altruistic process, and number of appointments are needed for the patients who are fit, young, and healthy women to come into the hospital. During the pandemic time, that was not feasible at all. So hence the waiting times are long. However, now we've got vaccines and other things. There is a beam of light out of this pandemic, and we are all set and ready to start the campaign for donors as soon as it is feasible and possible in 2021, which will help the donor waiting times. At the same time, I would like to say that if you've got anybody who wish to donate for you, who is young and is healthy, please do get in touch with the clinic, and we'll be happy to do initial investigations, consultations, and proceed with it. But there is a light of hope in 2021, and we aim to do a donor campaign, which will definitely have an impact on reducing the waiting times.
Thank you. And if I could actually just ask an additional question around donor treatment there. So for female same-sex couples waiting in donor treatment, how long is the waiting time for them at the moment?
Again, it is the same situation as egg donors, that we are short of sperm donors as well. And sperm donors, I don't know if everybody is aware that of 100 donors who contact us, we are only able to, who only reach the final donation, are only about 5 to 10 at the most, because we have got very stringent criteria. They have to come repeatedly to have various tests and investigations. So unless everything is absolutely right, we don't accept them as donors. Again, to have that many healthy people in the hospital during the pandemic time was not feasible for multiple visits. Hence, donor sperm campaign was halted as well due to pandemic. However, in 2021, both egg and sperm donor campaign will start and will happen. So all that will have impact on the waiting times and definite impact. And we will give it priority because we are aware that both egg and sperm donor have waited for long. So this donor campaign will be given priority, and all clinics have agreed to that.
Thank you. And I think that will be really helpful, and it's important information and updates that the community will find really helpful going forward. If I could just come across to Anne in Dundee, can your partner attend the appointment with you?
Thanks, Gwenda. We fully appreciate that the fertility treatment, if you're in a relationship, it involves a couple, which can affect both of you, and that you're both involved in any decision making. So this is one of the reasons why at the moment we're offering remote clinic consultations, so that you can both attend together. But we also need to keep you safe and to minimise any risks. So as you know, we had to put in procedures and processes in place so that we could get approval from the UK regulator, the Human Fertilisation and Embryology Authority, so that we could restart the assisted conception services in the UK. And one of those measures was to suppress the virus by trying to keep the footfall down in the clinic. So for that reason, unfortunately, we need to restrict the number of patients attending in person. So you may be asked to attend some appointments without your partner. For pregnancy scans, both can attend. So it may be helpful to check with your unit whether both of you can attend or not. In saying all of that, we're aware that the changes and the uncertainties at the moment can increase feelings of anxiety. You may be feeling sad, lonely, helpless, out of control because of the present restrictions. You may also feel a bit more isolated and may have less contact with your family and friends who may be there to support you. So if you think it would be helpful, either individually or together as a couple, you could perhaps talk to one of the counsellors, and appointments are still being offered by all the counsellors, either by phone or by using video conference services such as Near Me. So information about the counselling services, including how to arrange an appointment, is available on the unit websites. The counselling is a free service, it's confidential, and it's available to all of our patients either before, during or after any treatment. So please get in touch if you feel you'd like any extra help from us.
Thank you, Anne, that's great. And I think it was so important to know that the counselling services still continued, even when the pandemic was, you know, had really taken hold at the beginning and everything was closed down. So thank you for that. If we just go over to Edinburgh, to Kelly, what is the waiting time for self-funded treatment at the moment?
Thanks, Gwenda. Each centre is at a different stage in its ability to provide self-funded treatment. So the best option is to get in contact with your local centre to find out whether they're currently offering self-funded treatment to new patients.
Thank you. And just if I could just come back to you, Kelly, and ask, have medicated IUI cycles started in all the clinics?
Medicated IUI has started in the clinics that offer that treatment. So if you need that treatment, your centre should have contacted you. If your clinic has not been in touch, please get in contact with them.
Thank you, Kelly. And just coming back to Glasgow, to Joanne, what is the waiting time for PGD?
So PGD involves IVF, a cycle of IVF to create embryos, and then those embryos are genetically tested. The waiting time for this service is complex because it's mainly determined by the need for genetic tests rather than the waiting time or waiting list for IVF treatment itself. In the process, molecular tools are required to diagnose a particular genetic condition, and the waiting time for these tools to be developed can vary and are determined by individual circumstances, the individual genetic condition that is being tested for, and whether there are other family members that are affected, and that there are samples from those members to test also. So PGD waiting time is primarily dictated by the length of time it takes to develop the genetic tests and the genetic tools to diagnose the condition in the embryos, and that will vary for each specific individual.
Thank you, Joanne. And you know, we do see light at the end of the tunnel now, and there's been a lot of talk around the vaccine, and with that's always going to come questions and anxieties from the community. So coming back to you, Alison, will it be safe to get a vaccine if you're pregnant?
Thanks for that, Brenda. And you're right, there was lots of announcements last week, and indeed I think up to Friday and probably over the weekend. And the UK government did make an announcement about pregnancy. And at this moment in time, and it is an ever-changing situation, it's quite clear that there's no data at all on any safety aspects of the vaccine for pregnancy. Obviously, pregnancy was ruled out of any of the ongoing trials. So at this moment in time, given the lack of evidence, there's a precautionary approach being taken, and women should be advised not to come forward for the vaccine if they are pregnant at this time. And obviously I realise that's quite worrying for people out there. So please just keep up to date on websites. But at this moment in time, the message is quite clear that pregnancy, you should not go for the vaccine.
Thank you, Alison. And on the same topic, but coming across to Dave in Edinburgh, when we are able to get the vaccine, could this delay treatment if someone gets vaccinated?
Thanks, Gwenda. So as my colleague Alison just said, given the lack of evidence at this time, that's provided to us at the moment by the Joint Committee for Vaccination and Immunisation and the Royal College of Obstetricians and Gynaecologists, but they're both in favour of kind of a precautionary approach. So they're currently not advising a COVID vaccination in pregnancy. So women should be advised not to come forward for vaccination if they may become pregnant or planning to become pregnant in the next 3 months, or for the first 3 months of that first dose. Understandably, this might result in a small delay to your treatment. This will not disadvantage you in terms of your position on the waiting list.
Thank you. And I'm sure over the coming weeks, those questions will increase. But just as a final question before we'll go back to Dave to give a round off, coming back to Glasgow to Dr. Lyall, and this question is a bit lengthy. For those who are on the waiting list, is it possible for clinics to let people know in advance of starting treatment if tests need to be repeated due to being out of date, as this delays the start of treatment? Or alternatively, can clinics extend the time tests are valid for?
Thanks, Gwenda. So first of all, just a bit of explanation. The reason that we do the tests is to optimise patients' treatment, and there are some broad rules around when we repeat them. We don't repeat them unless we absolutely have to. So as a general rule, we would accept a semen analysis within about 2 years. An AMH, usually we would repeat after a year unless there's a reason to do it sooner. Things like blood-borne virus screening, that's things like HIV, hepatitis B and C, that is a requirement from the HFEA, and we have to repeat those 3 months before, or we have to do them rather 3 months before the first cycle, and within 2 years of subsequent treatments. But the clinics have been open since the summer, and we've been doing diagnostic tests since then. So there shouldn't be any reason why treatment should be delayed because of screening tests.
Thank you. That will really help inform the patients of why certain processes have to be in place and carried out. And finally, Dave, just to come back to Edinburgh for final comments.
Thanks again, Gwenda. So I have the pleasure on behalf of all the centres of thanking you all for your patience, understanding and support through these difficult times. We've had to assess our entire service in order to be able to offer treatment in a manner that's safe for you and of course our colleagues. It's because of these additional precautions that we've been able to continue to operate even in areas currently classified as level 4 by the Scottish Government. As you've heard from our speakers today, we have all been working tirelessly to get to where we are now, and we could not have done this without support from the Scottish Government, our colleagues from across all 4 centres, and of course you. Although currently the talk of vaccines and treatments is all very promising, the future still remains uncertain. That is why we have to kind of continue to keep face-to-face appointments and general footfall low. These precautions are all part of our winter planning document, which has been published on the Scottish Government website. As a good and an upside though, I'm delighted to say that we are introducing a new online information and consent platform across all 4 NHS centres early next year. This will give you access to information videos and consent forms ahead of your treatment. You'll be able to provide, each centre will be able to provide you with more information and details as they become available in your area. So finally, just to round things off, I'd like to wrap things up by saying, first of all, reminding everyone that in order to protect yourself, your family, your fellow patients and those responsible for your care, to continue to follow the Scottish Government guidelines, to not attend any appointments if you feel unwell or have any COVID-like symptoms, regularly wash your hands and sanitise where available, observe social distancing, attend your appointment at the time stated in your letter, as these are staggered for your safety and to avoid any unnecessary queuing, and of course wear a face covering while in the centre and on hospital grounds. We're all in this together, and together we can hopefully reduce the spread of the virus and quicken the return to some form of normality. Thank you.
Thank you, Dave. And just before handing back to Emily, I just want to say on behalf of the charity and everyone who we support, a huge thank you, because we are very well aware that you take time away from your clinics in order to be able to do these sessions. And it does mean a great deal both to the charity and everyone we're supporting. So just to hand back to you, Emily.
Thank you. I'd also like to say thank you to everyone who's watching. Thank you so much for joining us today. Hope you found it helpful. Later this week, we'll also release a webinar which you may also be interested in, all about coping at Christmas and other family-focused holidays. So do stay tuned on Fertility Network's social media for more details. Finally, if you need any support or information, whether that's a friendly chat on the phone, via email, or joining one of our free online support groups, please contact us anytime via the links in the description box below. Thank you all so much for joining us.